Over 40 million Americans wear contact lenses. But what do we really know about modern contact lens wear and care? In this episode of OCuTALK, Dr. Sabah Hasan will be telling us all about different types of contact lenses available, who should and should not wear them, and how to properly take care of them to avoid complications. Dr. Hasan?
I want to talk to you.
Not now, later.
No, now.
Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us, Dr. Sabah Hasan. Dr. Hasan, thank you so much for joining us today.
Thank you so much for having me. I'm glad to be here.
Well, excellent. Thank you for joining us today. We know you're very busy, but thank you for joining us and taking the time out of your day to visit with us. Dr. Hasan, before we get started today, I was hoping that maybe you can introduce yourself to us. Let us know a little bit about your background and your specialty.
Yeah, so I'm an optometrist practicing in Houston, Texas. I graduated from the University of Houston College of Optometry in 2019, and I have a background working in medical optometry through Veteran Affairs. I've also got some history working with cataract surgery, co-management, and now I'm kind of focusing a little bit more on primary care optometry.
Well, excellent. Again, Dr. Hasan, thank you so much for that introduction, and thank you for joining us today. So Dr. Hasan, for our discussion today, we were hoping that maybe you can talk to us a little bit about contact lenses. When do you usually recommend contact lenses to your patients?
Yes, so this is a great question. I really enjoy empowering my patients to pursue contact lenses when they are ready. So in general, as long as health-wise everything checks out, I recommend contact lenses when a patient expresses to me that they want to be free from glasses, but they're not ready for refractive surgery yet. And that can be for work-related reasons, recreational use, like sports and things like that, or even just cosmetic reasons.
Well, excellent. Thank you for that information, Dr. Hasan. And what different kinds of corrective contact lenses are available to your patients?
Yeah, so there are so many on the market now. Some of the most common ones are going to be your soft contact lenses. Those are the ones you hear about the most, and we've got dailies all the way to monthly disposals. We've got ones that correct for astigmatism, as well as color lenses, and even now multifocals that correct for presbyopia. And then we also have hard contact lenses, which are going to be like your rigid gas permeables. We also have ortho-K and sclerals that are mostly used for managing disease and irregular corneas.
Oh, well, excellent. Thank you for that information, Dr. Hasan. And so you just went through different types of corrective contact lenses with us. I wanted to ask, are there contact lenses that you recommend more often? I know you see a bunch of different patients, but is there one that you recommend more often than the other?
Yeah, so my go-to will always be a lens that's going to be high in oxygen permeability, which means oxygen going to the cornea, and then also ones that have UV protection in them. So my favorites are going to be the daily disposals because you're always getting a fresh new pair, and that's really going to minimize the risk of you overwearing the contact lens that can lead to issues down the line.
Well, excellent. Thank you for that information, Dr. Hasan. And are there any cases that you've come in contact with where, no pun intended, but contact lenses are better than glasses?
Yeah, so sometimes, we have patients that actually have a very large difference in the power correction between the two eyes. And when that happens, that can often lead to the world almost feeling like a different magnification. And so this is actually called anisoconia. So some of these patients actually really benefit from being in a contact lens versus glasses. And then sometimes you just have patients that have a very active lifestyle or even a job that requires them to use their full visual field. And so for these patients, contacts are probably a better option.
Well, excellent. Thank you again for that information, Dr. Hasan. And so now you talked about contact lenses being better than some other options, but are there any cases where contact lenses aren't really a good option at all?
Yeah, so there are times in which we run into issues where contact lenses are just not a good option. And that may be because a patient just may not be the right candidate because they may not be ready for the commitment that can come with contact lens care. They may have had multiple infections in the past that have led to permanent scarring of that cornea surface, which has led to vision loss. And so, for that reason, I would not want to prescribe contact lenses just for the sake of preserving vision in the future. And then we also have patients that suffer from really severe forms of dry eye or inflammatory processes where they just not may be able to tolerate those contact lenses at that time. So the best thing to do would be to treat that inflammatory process and then potentially visit contact lenses in the future if that becomes an option.
Well, excellent. Again, thank you for that information, Dr. Hassan. And so, what about? I know some people start contact lenses at certain ages. Is there an age requirement for this? And is there a minimum age that a patient can start before using contact lenses?
Yeah, so honestly, aside from contacts that are used for medical management, to me, there's really no magic number when it comes to contacts. But I personally like to wait until the patient and the parent express to me that their child is ready for contacts. Because honestly, parents, they know their children best. They know their habits. So I gauge them based on that since I only get to see them for a short amount of time, but I fit them as early as elementary school.
Wow. Again, thank you. That is very interesting information, Dr. Hassan. And so I'm always curious myself because I started off using contact lenses myself. I wanted to ask you for your patients who are getting their first contact lenses, what do you kind of recommend for your patients and how do you walk them through actually inserting and taking out their contact lenses?
Yeah, so at our office, we actually have amazing technicians that walk the patient through the entire process. But generally, the first thing is that we want to make sure that the patient is absolutely comfortable touching their eyes. So we walk them through getting those lenses in by properly removing the lid and lashes out of the way so that you have the most area to work with. And then when it comes to removing them, there are so many different techniques, but we want to make sure that the patient understands that they need to work with a gentle hand because scratches can happen. So we want to make sure the patients are using the soft part of their fingers, not their nails when they're removing lenses, and then to slide those lenses off onto the conjunctiva, which is the white part of the eye. This kind of helps that contact fold, and so it makes it a lot easier for a patient who's learning contact lenses. And then as they become more comfortable, you kind of find a way that works for you.
Well, excellent. Again, thank you for that information, Dr. Hassan. And you talked about having soft hands and being gentle the first time doing it. What are like how many people do you see struggle their first time through? Is it common to that for that, or is it really like do you see a lot of people who do it like a pro the first time?
So, absolutely. Honestly, if you're a pro and you don't struggle the first time, that's going to shock me more. So, it's very common to struggle in the beginning because when you think about it, it's a foreign object that you are purposefully putting onto your eye. And our eyes, they're designed to protect us. So, we blink, we have reflex blinking, we've got our eyelashes that want to shut as soon as you touch them. But honestly, practice just makes perfect.
Well, I hear that. I struggled mightily with my contacts early, so I totally understand that. Oh, well, again, thank you for that information, Dr. Hassan. And I wanted to ask you, how important is it to clean your contact lenses? Like, do you have any recommendations for people who are just starting out and wanting to know about cleaning their contact lenses?
Yeah, so absolutely. Cleaning lenses and hygiene in general, they are essential for me when I'm prescribing contact lenses because you have to remember contacts are a medical device. They should not be sold over the counter. So complications can happen. So we go over hygiene with every patient before we train so that they know what they are getting into. And then just some tips that I would have to keeping lenses clean is first, hygiene, right? Making sure you wash your hands every single time you're about to go touch your eyes, and then using a good multi-purpose solution that your doctor recommends. So you want to stay away from things like saline or using tap water because that has a huge number of bacteria in it. And then just always making sure that when you're about to go store your contact lenses for the night, you want to put it in a clean, dry case. You never want to use old solution. And then if you are a makeup wearer or you wear lotion, you want to make sure you apply your contact lenses before you put your products on.
Well, excellent. Again, thank you for that very vital information, Dr. Hasan. And actually, you just spoke about it a little bit in that last answer, and I just wanted to kind of go a little bit further if you can. What are the complications if someone doesn't clean their contact lenses and doesn't take them out on a regular basis?
So, unfortunately, not taking care of contact lenses can lead to infections and ulcers that can not only scar the cornea, but it can also reduce vision permanently. So, you can also suffer from dryness if you overwear your contact lenses, and this eventually deprives your cornea of the oxygen that it needs. So, this starts to lead to new blood vessel growth, and that can also lead to even more scarring. So, these are some of the most common adverse effects from misusing contacts that we want to avoid.
I will definitely. We want everyone to clean their contact lenses and have a safe and regular system there. Again, thank you, Dr. Hasan, for that information. Dr. Hasan, what about sleeping in your contact lenses? I know some people have told me that they've done that before, and I always think that there's going to be complications with that. Are there contact lenses where that's an option where people can sleep with their contact lenses?
So I don't recommend sleeping contacts very often, but there are FDA approved contact lenses that can be slept in. So for me, it is a case by case for my patients, and I always go through the risk versus benefit of doing so. But there are patients that do actually need to sleep in their contact lenses, whether it be a new mom or dad who has to wake up odd hours of the night and they need to be able to see, or even like a first responder. So they need to be able to get up and go. And so having that clear vision is essential. So I will always consider it for a case by case, but I will always tell them to make sure they take breaks when wearing those contacts.
Well, perfect. Again, thank you for that information, Dr. Hasan. And what new technologies and new developments are on the horizon right now that we should be on the lookout for?
Yes, so this is a great question, and this really excites me because contact lens companies are amazing. They are pumping out new technology left and right. And recently, we had a new contact lens that got FDA approved by Johnson and Johnson, and it has an ingredient called ketotifen in it, which is an antihistamine, and that is for people who suffer from allergies. So it actually claims to relieve eye itching in as little as 3 minutes. So I'm very excited to get my hands on this one for my allergy sufferers. And so for someone who does suffer from itching when they put contact lenses in, this may be a really good advancement.
Well, we'll definitely be on the lookout for those new technologies. Thank you, Dr. Hasan. And before we go today, Dr. Hasan, was there anything else that you'd like to tell our audience about?
Yeah, so I just wanted to throw this out because if you are interested in contact lenses or in the past you have been told that you may not be a candidate, don't be afraid to revisit the topic with your optometrist because so much has changed in the eye care industry that there may be new options out there for you. So never hesitate to ask.
Oh, well, awesome. Again, thank you for that information, Dr. Hasan. Everyone, that was Dr. Sabah Hasan. Dr. Hasan, thank you so much for joining us today.
Thank you so much.